Right, good evening and many thanks for joining us here on KUTV Primetime News. Indeed, it's a day that we have much and more lined up for you, including today's budget that was read by Treasurer for Cabinet Secretary, that is for budget and financial, matters to do allocation, that is Professor Njuguna Ndung'u. And of course, it is an estimate of 3.6 trillion budget, and out of this is an increase from 3.3 trillion in the previous financial year, the 2022-2023. Now, there are key allocations that the government has seen it fit to be allocated some a lion's share of the 3.6 trillion. Out of this, development has been allocated 7.18, that is 718.9 billion. Then another key area that has been allocated, that is national government, has been allocated 2.3 trillion just to finance the operation of the government. Another key area, that is county government, has been allocated 385.4 billion shillings. Then public debt has been allocated 1.6 trillion. And of course, this one will be to service the debt that is projected to be at roughly 9 trillion. Well, today, and my guest that will be helping me to unpack this, the budget, the 2023-2024 budget, is Abraham Ochieng, International Budget Partnership Kenya Program Officer, Advocacy and Outreach. Well, that discussion will be coming to you later on, but first thing first, our reporters have been working round the clock to bring you up to speed with the latest in the world of politics, business and sports. But first thing first, our top stories tonight. Tonight, a whopping 3.6 trillion. Treasurer CS Njuguna Ndung'u unveils President William Ruto's maiden budget. Costly and punitive. Azimio gives 2023-2024 budget a white bath as they walk out of chambers to gears and cheers. Plus, fixing the loopholes. NHIF cancels tenders worth 7 billion, citing massive irregularities. Easing pump pain. Prices for super petrol and diesel set to decrease by 0.6 per litre and 1.2 per litre respectively. Alone, I'm in full backup of SAMMY OKELLO as our sign language interpreter tonight. My name is AUMA Evans. Remember, you can chip in into this discussion on all our social media platforms, and we'll be sure to sample all of your feedback at the tail end of our broadcast. Now we begin our bulletin tonight in Laikipia, where Laikipia County Governor Joshua Irungu, while speaking at the 100 years of Cottage Hospital celebration today, has called for public-private partnership for hospitals in Laikipia to ensure residents receive quality health services. Irungu noted that this can be achieved through developing a skill-based program between them that will ensure doctors and nurses get to learn from their more experienced colleagues so as to widen their knowledge.
100 years of service through an event which was graced by Laikipia Governor Joshua Irungu, who encouraged private hospitals to collaborate with public hospitals. Irungu said that the partnership will effortlessly reduce the huge amounts of money residents spend on seeking specialized medical services abroad because they will be locally addressed at fair prices with the now available advanced equipment and highly skilled personnel.
Then I don't think there is any kind to get some of you come and help us there, even in terms of skill development, because you might have advanced skills which our health center, our staff might not have because of exposure, because of the advanced equipment, and because of all other and the experience that 100 years that you have been service. And therefore you have experiences, you have advanced skills that probably it's inadequate in our people.
The Chief Executive Officer of Nanyuki Cottage Hospital, Dr. Anup Das, said their hospital is ready and willing to collaborate with Nanyuki Teaching and Referral Hospital through a skills exchange program, since Nanyuki Cottage Hospital boasts of being a super specialty facility. Das added that they have launched a township outpatient clinic which will even cater for the bottom of the pyramid patients.
We are already discussing with the governor for a public-private partnership where we are able to help each other, specifically the Nanyuki Teaching and Referral Hospital and collaboration between Nanyuki Cottage Hospital. The idea is that because we have launched the concept of super specialty here, we have the doctors in-house, the resident doctors who are starting basically teaching programs and internship programs here.
Dr. Anup revealed that the hospital, which is a level 5 facility, is set to install a minimal access machine that will help patients who require surgical operations to get treatment even without undergoing the actual surgery. Dr. Anup stated that the laparoscopy machine will be the first one in Africa and the second one in the entire world after China.
And very soon we will have the most advanced laparoscopy system. And as I said, it will be the second such installation in the whole world. So you can imagine, and we should all be proud that such an equipment is being installed at Nanyuki Cottage Hospital, and we have the right doctors to work on it.
These advancements come after the Ministry of Health 2015 to 2020 data revealed that a lot of Kenyans travel to more developed countries like India to seek special medical attention. Ivy Bina, KUTV.
Right now to our top story of the day. The National Treasurer Cabinet Secretary Professor Njuguna Ndung'u has finally read the national budget for the fiscal year 2023-2024 in the National Assembly. Professor Ndung'u has narrated that this year's budget was prepared against background of uncertainties, including the post-COVID-19 challenges, climate change, and the geopolitical tension in Eastern Europe. The CS has mentioned that economic growth rate is expected to rise as compared to the last year.
2 p.m. today. National Treasury Cabinet Secretary Professor Njuguna Ndung'u made his way to the Parliament buildings where he read the budget for the fiscal year 2023-2024 in the National Assembly, an act that is occasioned by the Standing Order number 241 of the National Assembly, the budget being the Kwanzaa government.
Minister, proceed.
Thank you. Professor Ndung'u says that this year's budget was prepared against a background of uncertainties occasioned by a number of factors, especially the prevalent COVID-19 as well as climate change, which has negatively impacted the agricultural sector.
The financial year 2023-2024 budget has been prepared against a background of a challenging external and domestic environment. In addition, the COVID-19 pandemic Kenya has, over the past years, suffered and also a series of devastating negative and persistent shocks that include the worst drought in decades, as well as adverse spillover effects of the conflict in Eastern Europe and a tight global financial market condition.
Ndung'u says that this year's budget has placed emphasis on priorities under the bottom-up transformation agenda as provided for in the government's 2023 policy statement. The prioritized areas include agricultural transformation, medium and small enterprises, housing and settlement, healthcare and digital superhighway, and the creative industry.
Mr. Speaker, in order to